Hi, and welcome to another Workout Tip Wednesday. I'm Chris LeBlanc, Czech practitioner and holistic lifestyle coach. In the last few videos, we've been looking at a couple of our four inner doctors, Dr. Diet and Dr. Quiet. Today, I'd like to talk about Dr. Movement and his focus virtually on our body. So it's quite obvious that we're moving far less nowadays than we ever have in our history. We have so many people using power tools and electric devices instead of physical labor, food that's conveniently located at grocery stores or restaurants, very sedentary employment. It's all creating a deficiency in movement. One study actually suggested that 8% of males and 3% of females were doing any regular exercise, including dog walking as exercise. So you can pull up all these different studies, I'm sure, and slightly different numbers, but they're very, very low. So what movement or what our bodies are designed to do is move, and they act like kind of like a water pump, an old school farming water pump, and they pump, muscles pump water, blood, oxygen, they pump all this through our body. And when we don't move enough, these fluids, they become stagnant, and our waste becomes stagnant and virtually sits in you. So if you're not moving enough, some common symptoms, low energy, difficulty managing blood sugar, weight gain, chronic aches and pains, constipation, increased risk of disease, mood swings, depression, the list goes on. So life is movement, we're designed to move. Following the advice of Dr. Movement, this will help you optimize this pumping action. And some common misconceptions with Dr. Movement is when I say Dr. Movement, people think exercise. And this is only half the equation. So workouts or exercise is one half, and something called work-ins is the other half. So workouts, going to the gym, lifting weights, jumping on in a spin class or a group class, running outside, etc. These are all things that we're pretty used to hearing. A work-in are things like having a walk. Not a power walk, but a walk that doesn't elevate your heart rate. Doing some stretching, yin yoga, some tai chi, some qigong. Anything that's virtually going to cultivate more energy than it uses or it expends. This is important as a work-in boosts your energy, it stimulates and fortifies your body, and a workout, it's catabolic, it breaks down your tissue, it requires energy to build you back up. Okay? Many people that walk in my door here, they have low energy, they want to lose weight, they have aches and pains, they're not sleeping well, so they're not following Dr. Quiet, who we talked about, they're not eating well, so they're not listening to their Dr. Diet. These are people that need work-ins. Unfortunately, many things out there show that they need to do the opposite. You got to hit the gym, you got to sweat more, you got to do this boot camp with Sergeant Slaughter, you got to do this high-density circuit training with Olympic weights or these straps. There's these forms of movement, they're great if you're healthy. Unfortunately, they will lead to pain, injury, and negative side effects if you're not, and many people aren't. So next video, what we're going to do is we're going to demonstrate how to identify if you need more work-ins than workouts, and show you a few of our favorite work-ins. So until next time, with Chi.